Pin Drop Podcast, a podcast where we discuss all things about hearing loss and cochlear implants. We'll be talking to researchers, scientists, surgeons, audiologists, associated health professionals and clients about their life and work, what inspires and motivates them. My guest today is Associate Professor Grant Searchfield from the University of Auckland School of Population Health. Grant is the Director of the Hearing and Tinnitus Clinic at the University and also Director at Tinnitus Tunes. It is estimated that 1 in 10 New Zealanders are affected by tinnitus, with 1 in 10 seriously affected. That's 45,000. Welcome, Grant, and thanks for being with us today.
It's great, thank you for having me.
Grant, your work on tinnitus has been advancing our knowledge of tinnitus for nearly 2 decades now, and your groundbreaking work has been recognised internationally. When you were starting out as an undergraduate student, did you know this was the area you wanted to specialise in?
No, it's quite an interesting story. When I was in my audiology degree, we often had topics that we were asked to review and present to our classmates. And one of those topics that I was assigned was tinnitus, which fate, I suppose. And so that was interesting, but it was actually only when I was practicing in my first year as an audiologist that my drive to look at this a little bit more actually emerged. I was always very keen on the idea of doing research and furthering that, but was unclear of what that area would be. But what really sparked my interest was the fact that I was working as an audiologist in a clinic where people would come in and they would say, I have tinnitus, and so on. And when they complained about hearing loss or they wanted their hearing tested, I felt fairly confident that I had the skills as an audiology graduate to be able to manage that. But when they began to talk about tinnitus, I felt that while I had been taught some aspects of it, I really didn't have the tools at hand to be adequately able to help them. And so that started me really needing to do a little bit of work behind the scenes to try and really be able to gather those tools and gather the understanding so that I might be able to help my clients rather than sort of shrug my shoulders and say, well, I'm sorry there. So that's really what started me on the road for looking at tinnitus. And I suppose my passion started largely by my inability to help people in that area. Yeah, so really, because that's really, from that was what your drive was to dedicate, because you've dedicated your career now to that. Yeah, and one of the things that I suppose at the time also pushed me in that direction is I was thinking, I don't really want to work in an area where I'm not going to be able to progress the knowledge. And I felt that in the tinnitus area there was so much that could be done and so much that needed to be done that I felt that I could perhaps make a difference in that area as well. So it was the need and the feeling that, well, maybe I could actually contribute. Yeah, you could actually do something. So we'll go back to basics, Grant, because quite a few of us, even myself, like whenever I first started in the area working alongside clients who need a cochlear implant, is getting the fundamentals of hearing. So can you explain to us actually how our hearing actually works and the role it plays in our sensory world? So while we think about the auditory system and its role of hearing as being very important for communication, which it undoubtedly is in hearing speech, there are other aspects of its role that are very fundamental for the way that we navigate through our environment. A very basic and perhaps the most important aspect of hearing for survival is our ability to localize where a sound is coming from and to be aware of our environment, because it's this that enables us to identify threatening sounds and then react to them. So it's like an alarm system. It's our survival sense. So what we would think about in a multisensory system that we have is that audition, hearing, is our alerting sense.
Oh, yeah.
Vision is our confirmatory sense, and touch is our interaction sense. So, for example, this is something that I often kid with my optometry and vision colleagues, is that hearing is so much better than vision because we can hear around corners and you can't see around corners. But of course, what happens is that when we identify something with hearing, then we want to be able to confirm it with vision. And this is one of the interesting things that segues into the tinnitus area, is that tinnitus is one of the few auditory perceptions that we can't see what is making it. So that's really quite unnerving for us, because if we're in a survival situation, we're moving through an environment and we hear a sound, we make a judgment about whether that's something that we want to attend to or not. If we are concerned about it, because we think there might be something threatening in our environment, then we begin to pay attention to it, and then if it is something we are quite concerned about, flight mechanisms begin to become elicited. And if we're then able to identify what the source of the sound is, and it turns out to be something quite benign, then that gets turned down. We've identified it through vision, but we've identified what that sound source is, we can move on. But if that threatening sensation is there and we can't actually make sense of it through our vision or other means, it lingers on as a threat. And if that threat becomes a concern, so if we were to hear a sound in our environment and it turned out to be a very aggressive dog, well, then having that fight or flight reflex would help. We'd run away or we'd do something. And it's useful there. But what if we weren't able to confirm that, but we began to think of something as potentially threatening? So often a person experiences tinnitus, a sound in the head or ears for the first time, and they'll say, what is that? They might actually look around in the environment to try and find the sound source. And when they can't find it, it becomes annoying. But then they also begin to think, oh, what might be causing that? Is it something that I should be worried about? Is it something that's going to affect my health? And then it becomes very much like the dog in the bushes, sort of looking there, where we're continually aware that there's something threatening in our environment that we really don't know about, and should we be worried about it? That focuses attention, and it focuses our audition to become better at hearing that. So if we think that there's an aggressive dog there,
of course,
we know what an aggressive dog might sound like. We begin to become better at hearing that, and we focus more and more our attention there. So that if in fact it is there and it comes out of the bushes, we're able to react quickly. In the case of tinnitus, a threatening sound, we're not entirely sure what it is there as a perception. So we become better and better at listening to it.
Oh gosh, of course.
And of course, then what happens then is it becomes more and more to the forefront. And as a consequence, we get into a very vicious cycle that we attend to it more, so it becomes more prominent. We worry about it more, so we attend to it more. And this is why we have a huge range of experience from a person who might experience tinnitus as something as a sound that's perhaps mildly annoying but not a particular problem. But another person might in fact experience the same sound but experience it as a huge catastrophic effect on their life, because these different mechanisms can be initiated for various reasons. Now, it may be that the person that has it particularly bad has a very negative association when the tinnitus began.
Of course,
So it might be something related to a stressful event. Maybe someone close to us passed away. Or in the case of and a person in the military, for example, it might have been quite a horrific event.
Yeah.
So in the perfect recipe for horrible tinnitus is an event where there has been a change in the hearing system associated with a traumatic event in the environment.
Yeah.
And this is why the number one service-related medical complaint in the US military is tinnitus.
Really?
So this is followed second by hearing loss.
Yeah, because I was going to say, like, you know, do hearing loss and tinnitus go hand in hand, or can you have one without the other?
You can have one without the other. There's debate about whether you can have tinnitus without a change in the hearing system.
Yeah.
Certainly you can not have any noticeable change in your hearing from a communication point of view and still develop tinnitus. But it appears that really that perfect recipe is the change in the hearing system plus emotional context, and also who we are as an individual. Personality plays a part.
Okay.
Some people who are very relaxed and are quite chilled may be mildly annoyed by the tinnitus, but they find a way of really not bothering them.
Yeah.
While a person that is more focused on their environment and are very aware of their environment might become more anxious about that. And we know that, you know, some people do respond differently in different environmental situations.
Yeah.
And when I'm talking to people about this, they say, well, are you saying that because I have tinnitus and it's a problem for me, that it's my personality or something, that it's my... And what I explained there is that, well, this is a contributing factor, but you may also be the person that actually, if you were in the survival scenario, you might be the person that actually survived because you are more likely to actually react to the sound in the bushes and then get out of there than the really chilled person who might actually find that
there's an adaptive mechanism for it. So
we have to accept that these sorts of things, who we are, both our lifetime experiences, the reactions that we have to certain things, all contribute to tinnitus perception. So damage to the hearing system associated with hearing loss would be the number one trigger.
Right.
But there are other factors that can determine whether the tinnitus there becomes a problem or not.
Right.
Including the information that we get.
Yeah.
So if we're worried about what this thing is and we go onto the internet and we search tinnitus and then we read all these horror stories,
of course,
then we think, well, this must be what tinnitus is.
Yeah.
But in reality, for the majority, as the statistics that you mentioned there, a lot of people experience tinnitus and it's not a problem.
Yeah.
So understanding what that thing that might be in the bushes actually is incredibly helpful.
Yeah.
So if we pull back the bushes and we see a cuddly teddy bear, well, we're going to have a different reaction than if we pull back the bushes and we see a ferocious dog that's baring its teeth at us.
Yeah.
And this is part of the process that we try and use when we're talking about tinnitus, and that knowledge is a huge ally in the process of actually defeating tinnitus.
Because that was what I was sort of going to ask was, like what happens when sounds exist inside your head, which is sort of alluded to. It's because if you can't see it and you can't identify it, there's just this ringing there. So what is the mechanism that's made the brain interpret sound when there is none? Like, what is actually the mechanism that's going on there?
And this has always been the incredible challenge to tinnitus research, is our inability to very clearly identify a particular thing that is happening related to tinnitus.
Yeah.
We first thought that tinnitus was perhaps created by the ear as activity, very much like the way that we would have activity created in the ear for external sound.
Yeah.
But research found that the auditory nerve really wasn't more active
Okay.
which we would normally expect. If a sound comes in,
of course,
then activity in the auditory nerve increases. And it's not that simple. It appears that there are various compensatory mechanisms happening at various levels of the brain that take a reduction or changed activity in the auditory nerve and try and make sense of it and create patterns that aren't actually there.
Yeah.
So
it's a bit like, it's a bit like phantom limb, because I've heard it associated. I mean, a comparison made where we would say phantom limb, where you haven't got a limb but you're experiencing nerve pain, where tinnitus is somewhat as being compared to that. That analogy has been used with that.
Yeah, and this is one of the many of the aspects of what people experience in phantom limb pain and complain about are very analogous to what people experience with tinnitus well. It's something that people can't see, so it's very difficult to communicate to another person.
Yeah.
It has a real sensation for the person. This is not imaginary.
Yes.
It is real activity in the body.
Yeah.
It is creating real changes in the brain.
Yes.
And in the case of phantom limb pain, the person is feeling pain in something that's absent, or perhaps a itchy sensation.
Yeah.
In the case of tinnitus, there is an area perhaps of the ear that is no longer working quite as well.
Yeah.
But that region that is not working as well is having this new representation in the brain.
Yeah.
And we know now that there's no single area in the brain or the auditory nerve that is increased that is necessarily related to tinnitus. We begin to think of tinnitus as a network problem. And if we look at the activity within a group of people that don't have tinnitus, and we have a look at a group activity in a group that do have tinnitus, what we see is, yes, there are changes when we look at the area of the auditory brain. Yes, there are differences. The tinnitus person, the auditory brain seems to be active in different ways. Perhaps the more startling difference is the activity and the connections with other parts of the brain.
Okay.
So parts of the brain that are involved in memory seem to be connected up greater when there's tinnitus there. Parts of the brain that are involved in fear and anxiety, which sort of links into what I was saying there. Parts of the brain that aren't necessarily just involved with audition, but are involved in the sensation of touch. And possibly even a disassociation between other areas. So less of a close link between vision and audition. And what I mentioned earlier on is this fact that tinnitus is one of the few sounds you can't see something making it. We can see a fan making a fan sound. If we wanted to, we could even go and touch it, feel it. We could feel the wind on our face. Very real. But when you experience tinnitus, the sound is there, but there's none of these other sensations. And of course, the brain is thinking, "Whoa, what's going on here? This is I haven't experienced this growing up." You know, because when I've been growing up, when I was a toddler, of course we don't think about this, but this is what the brain is doing. It's saying, I learned that if there was a sound, there was something making the sound, and if I touched it, there'd probably be a vibration associated with it. But here's this sound, but what's causing it?
Where's it coming from?
And even worse, it's in my body. And as we have learned as we've grown up, typically things that go strange in our body is something that we pay attention to and we get concerned about. So this is one of my interests and alludes to those topic areas that you mentioned, this multisensory aspect of tinnitus. Yes, we hear tinnitus. It's an auditory experience. But there are other aspects that are going on because there is this disassociation with vision. But there are other parts of the brain that are activated by sound that actually create or somatosensory. The touch system is beginning to create auditory sensations. For example, perhaps around about 40% with tinnitus of people with tinnitus can change it in some way with head or neck movements.
Oh, really?
Now, why is that? I mean, that seems quite unusual.
Yeah.
And it seems that when there's a hearing loss, some of the input to various parts of the auditory processing system become overtaken by the somatosensory, the touch system.
Right. Yeah.
That again seems unusual. Why should there even be interactions between the auditory system and touch?
Yeah.
One contributing factor is that when we listen, when we localize sound, we move our neck, we move our head, right? And we do that. We're not conscious of a system that's changing. We hear a continuous change in our audition. But that's learned from our auditory input. And we learn that when our neck is in a certain position, we will hear a change. And so this connection there exists so that when we do move our head to localize sound, there's not a lot of noise introduced into the system, that it seems like it's a continuous, seamless system. But it's built on the fact that these senses are interacting. And so one of the things that we've been looking at is, can we incorporate visual activity or touch activity to help train the brain that tinnitus is actually more real than what it seems?
Yeah, because that was sort of leading on to there's a couple of questions which you've covered off, like the devastating impact, like why it's more devastating in some people, which we discussed. And then how do people cope with the internal soundtrack? Which they can't escape from and only they can hear, which you've started to talk about with the touch and the sensations that to help them cope with it. So can you...
Yeah. Most people will find that tinnitus is at its worst when they're in a very quiet environment.
Yeah.
So when we are in bed at night trying to get to sleep,
of course,
we hear tinnitus because there's no competing sound, generally. And also because we're not busy with other activities. People often find that tinnitus, they cope with tinnitus during their working life, but when they retire, and it's not necessarily that the tinnitus has changed, but the demands on them as an individual have changed. So if we're distracted, we're busy doing other things, there are less resources in the brain to pay attention to tinnitus.
Exactly. So,
if we're calm, we might be sitting at home trying to relax, read a book. There's less demand on our brain at that particular point. So the brain goes searching for activity, and what it picks up on is tinnitus. So in general, if people play sound in the background, they'll find that the tinnitus is less intrusive. So this is something that most people find out by themselves, having some sound in the background, and often they'll find their ideal sound.
Which helps habituate the ringing in their ears.
It helps, in a very simple perspective. It covers up the tinnitus sound. It becomes less obvious. The sound itself might be quite relaxing. So if they're tense because of the tinnitus, if they're listening to a piece of music, they might chill out a little bit. And over time, if they gain the sense of control in a way of actually controlling their tinnitus through sound, then the brain can begin to unwind. That process where it winds itself up to pay attention to the tinnitus, and so it becomes becoming better at hearing tinnitus, so focuses more on tinnitus, so that which creates bad tinnitus can be unwound, because if there's something interfering with the tinnitus, that it means that we're not paying as much attention to the tinnitus. We become less focused on it. And we can begin to break down that vicious cycle of attention.
Because it was interesting, Grant, on that, I was looking through the Twitter sphere yesterday on tinnitus and seeing what was out there about tinnitus, and British Tinnitus UK had an article on mindfulness and tinnitus. So just when you were mentioning there now about the brain unwinding, it was about it sort of sparked that sort of what it yesterday.
And so of course what mindfulness is about is essentially living in the moment. So often what a person with tinnitus will be thinking about is their future.
Yes.
They become worried, or does this mean I'm going to lose my hearing?
Yes, of course.
Is the tinnitus going to get worse?
Yeah.
But mindfulness is about bringing the person back to the moment, not letting their thoughts escape and take them and capture them and send them down a road that they don't need to go down. And so mindfulness can certainly be helpful. Now, it doesn't change the sound of tinnitus.
Yeah, absolutely.
But what it does enable, and many other mechanisms, relaxation strategies, others do, is to try and take that negative association and the winding up process out of the picture. Some people do struggle with actually achieving that mindfulness approach. People that, of course, essentially mindfulness and meditation have strong similarities, and some people find that they can enter this very relaxed state relatively easily. Other people really struggle to learn the technique.
Yeah.
And so sometimes using sound in the background as a form of guided mindfulness, or an aid to mindfulness, or an aid to positive visualization. So, for example, if there's a sound of rain, people quite often find that a very relaxing sound, or ocean waves. And if you can place yourself within that environment, and you think that those sounds actually are representing the environment there, perhaps you're remembering a really pleasant holiday, you begin to put yourself into that phase. You're moving yourself away from thinking about other things and back into an environment which is not focused around tinnitus. So a lot of the treatment approaches, both from a psychological perspective with cognitive behavioural therapy, which is a mechanism of providing psychological therapy, and more audiology-based, hearing-based therapies. Really where the similarity is to try and enable the individual to have a mechanism for coping and managing this. Some of the audiology-based therapies try and actually change the auditory networks that I talked about to try and eventually change the tinnitus so it's not there. But that's really where the difficulty actually becomes, because the brain is so complex and it has compensatory mechanisms. But we know, for example, that if a person has a hearing loss, and they have a hearing aid, they're suitable for a hearing aid, that a lot of people, the majority, will not have as severe tinnitus when they're wearing the hearing aid. Similarly, an individual that has a very severe hearing loss, and they have tinnitus before they have a cochlear implant, the cochlear implant, in many cases, not all, but in many cases can benefit, because what is happening is the person is going from a state of non-competition with the tinnitus to a state where there is activity in the auditory system that is challenging the tinnitus. It's competing.
So have you found those clients that would have a severe profound loss before it would be, because really it would be quite hard to have them, to distract themselves from the noise that's going on, their internal noise that's going on inside their head, because they're getting no external
they're getting no auditory competition. Now, some of them find other ways of distracting themselves, so they might get busy in a visual task and so on. But often I think some of the worst cases of tinnitus, as far as the sound aspect of it is concerned, is when there is no competition.
And we had GPs, we were at the GP conference earlier in the year, Grant, and a couple of them had come up and mentioned cochlear implants as a treatment for severe, for the tinnitus. Has that been something that you've found where it has been beneficial?
Yes, well, I think that experiences will be different. But now in Europe, for example, when a person has a unilateral hearing loss, so they have a severe hearing loss on one side,
Yes.
but they have good hearing on the other ear, which currently we wouldn't be eligible for funding often in New Zealand.
But privately they could.
They could do,
Yeah.
but certainly through the public system.
Yeah.
The implant on the poor ear is being done not necessarily because of the hearing loss, but because of the tinnitus in that ear. So there is a transition where the cochlear implants are not just being seen as helping the hearing, but as a therapeutic mechanism for helping tinnitus.
Wow.
And so if a person has a small amount of hearing loss,
Yes.
we would be thinking that hearing aids are going to perform that role of providing competition for the tinnitus.
Yeah.
If they have a severe to profound hearing loss, the hearing aids are not going to help.
Of course they're not.
So they need then the cochlear implant. And then the cochlear implant is providing that competition in a different way,
Yeah.
but the concept is still the same. And we know that, wow, the brain changes a lot before and after a cochlear implant.
Yeah.
Not in a bad way. When we're saying that the brain changes, of course, I need to make clear that we're not talking about the brain looking any different. You know, it's not shriveling up or expanding.
The networks that light up and stuff.
Yeah, when we look at brain imaging
Yeah.
and we talk about functional change.
Yes.
So the parts of the brain are still there, but their relationships are changing.
The pathways between
the strength of relationship between one part of the brain and another part of the brain can become stronger when those two parts of the brain are activated together.
Wow.
So if we're hearing, if the auditory system is receiving that information and the visual system is receiving information, we put them together, bang, we're able to watch a person's face, able to see their lips move. We have the auditory information as well.
Yeah.
We put it together, we make sense of it. And so this is a very important aspect that we use our sensory system. And when one system is not working quite as well, we rely on another system more. And we try and get checks and balances there. And so, yes, we're seeing these moves where we know hearing aids work. We want to be able to improve the way that they help with tinnitus.
Yes.
Likewise with cochlear implants. New innovations in trying to target a tinnitus specifically by using different combinations of sound are emerging. Some of these will work. Some of them will be proven not to work. But digital technology and our ability to record a sound and then change it is tremendous. And we have the technology and the ability to use all sorts of different ideas in creative ways. But the challenge remains, the biggest challenge is the fact that tinnitus is so different from one person to another.
Yeah, so it falls into that remit of personalised medicine, isn't it? Personalised treatment, your health.
Absolutely, and being able to identify for a given individual what their tinnitus is like, what caused it, how it reacts, how the tinnitus is changed by different things to see whether that's positive or negative. And so there is a huge range of not just categories of tinnitus, but within these supposed categories, one individual is going to respond very differently. So we need to think about our ability to provide personalised medicine, precision medicine, where we're able to do a number of tests and be able to characterise it in a particular way, and then have a treatment for that particular person. Now, I think that, before this interview, we talked about this cure idea. And I think everybody with tinnitus would like to be able to do something or take something that the next day or the next week, as we're so used to it, will go away. We're so used to going to the doctor for a scratch or a rash or an allergic reaction. We get a pill. We have to might take that for a couple of weeks. We'll put up with an upset stomach or something, the side reaction, that happened with it. But in a couple of weeks, it'll gone. Now, currently that doesn't exist for tinnitus. Will it ever exist? Well, probably not one cure.
Yeah.
But if we get clever enough in being able to identify the specific nature of tinnitus for a given individual, then we may be able to tailor a medication for this. And there is interest within pharmaceutical companies, the wider science community, in finding cures for tinnitus. Tinnitus is not being ignored, but it's a very difficult beast to research.
And again, it's another, I think it's because it's one of those invisible conditions, isn't it, where we don't see it, we can't see what's going on inside somebody's head, and that is what makes it hard. But there's so many people, it's prevalent, 1 in 10. I mean, it's a huge number of people, isn't it? It
is. And when we see a person that's had a scratch on their hand and there's a bit of blood there, we can see it. We can recognise that it's relatively minor, but we say, oh, you've got a scratch on your, poor you. If we see a person and they've had an amputation, and we can sympathise. Oh, what's happened? But of course, with tinnitus, a person might have the tinnitus equivalent of a scratch on the hand, but they might have had a catastrophic tinnitus, the equivalent of an amputation, if you like. But I can't tell. I look at, I can't see that when I see clients in the clinic. They come in. I can't tell by looking at a person whether they have tinnitus, whether they have mild tinnitus, whether they have catastrophic. And so it doesn't have that in-your-face traumatic effect.
And it was interesting, I was listening to an interview with it was an Irish podcast, Grant, about the catastrophic tinnitus, and it was a young man. He was suicidal. And I think, and he'd known someone else who had actually, it had driven them to that far with their mental health because it was unrelenting and they couldn't stop it. And, and I think that's, what can we do for somebody that's got catastrophic tinnitus? Is it just diversion and distraction therapy that we're trying to, or are we, if there is severe loss, are we implanting, aiding, or what is actually out there for them?
Well, it's certainly a challenge. And we can't look at just one aspect. What we've tried to instill in our clinicians and the students that come through our program is very much the importance of taking a holistic view. Even though we're training audiologists and obviously their focus is on the ear, and traditionally it's been about fitting hearing aids, but that's not enough. We have to look at various aspects, and we have to really place our own speciality within the area of other specialities. So if we see a person that's particularly distressed, perhaps with anxiety or depression complaints, we need to see is this person, for that particular aspect of their tinnitus, should they see a psychologist? Perhaps they need medication to help that, maybe just to get them to a certain point where what we might do might become more effective. We need to look at the environment. Are there things that are taking place in their environment that are amping up their tinnitus? Can we deal with that? And of course, although it's relatively rare within the sphere of tinnitus that a person will begin to think about self-harm, it does happen, and we need to have mechanisms in order to be able to get that person to a point where it does not have that catastrophic effect. Certainly most people with tinnitus do not have it in that catastrophic complaint, and certainly people shouldn't be under the impression that if I have tinnitus it's going to evolve into that particular point. Typically there are lots of things in play when a person has it to that degree, but from a clinical point of view, and for particularly a person there that's thinking, I've got a friend, family member, what can we do? Well, there are a number of things that can be done. There's various self-help mechanisms. People want to be careful about going onto the internet because they can obviously read some things that are just incorrect. So there are a number of safe websites. You mentioned the British Tinnitus Association. fantastic. The American Tinnitus Association, fantastic. Very useful, helpful information. We set up a treatment website, which you mentioned in your introduction, Tinnitus Tunes. And this was established as a semi-commercial, semi-research outreach, subscription-based website intended to have a low barrier to access, but provide all the expertise that we provide in the clinic that people can go on to access 24/7. If they have tinnitus, perhaps they're going to take a while before they can see a clinician. They can go online, they can get this. There are self-help things there, those sorts of things that people can seek and find help on, safe, helpful advice. And then when they see the clinician, that essentially builds on the ecosystem of help. Again, it's that holistic wraparound service that we're trying to provide. If a person is obviously talking about self-harm, then the significant other should look out to those crisis teams that they can help with that. If they are complaining about their tinnitus and it's becoming a problem, then they should search out the clinics or the clinicians in their environment that can help. Certainly their general practitioner, their family doctor is someone that they can talk to. The amount of expertise that lies in that area is not extensive, but it's the first path in trying to find where people should go. And then they might be directed to an audiologist, or they should seek out an audiologist. Because doing a hearing test is at least the first part in the process, identifying what is potentially the cause of this. And then a process of identifying, are there any medical causes, which usually there aren't, but it's ruling out these sorts of things, and then finding an avenue for a treatment process going forward. And there are treatments there for tinnitus. It is not the case that nothing can be done. So if people get that as a message, they should seek another opinion.
And I think, as you said, there is things that can be done to help mitigate, and especially if you feel it is getting worse, to bring it back, and steps you can take in place there is steps that are there that can actively be taken.
Absolutely. And while we will say at the moment there is no cure, let's just say if you go to a person with tinnitus and you say, well, I can't take it away totally, but if I could reduce it by half, would that be helpful? And I think most people would say, well, they would like it gone completely. If you could take it away by half, well, that'd be brilliant. And, these sorts of treatments can take it away by more than half.
And which is a good thing, because, your starting point is where you just feel it's there all the time. But as you can see it reducing, it means that you can cope better with it, isn't it? And it's that sort of
absolutely,
being able
and
to manage it.
You get on the road to recovery as you gain more and more control. The brain will let you gain more and more control. So if you take away the mystery, you pull back the bushes, you show that it's actually not a dog that's going to jump out and bite you. Right? That's about finding out what tinnitus is. It's about putting in place some ways of taking the edge off the sound. So by playing other sounds can help. By finding a way of reducing anxiety or stress about it. So mindfulness, relaxation, these sorts of techniques. And once you put these all together, and you have to find your own best way, because what works for one person doesn't work for another. There might be a sound that you like that another person hates. So you've got to find each of these, and clinicians are often good at helping guide this particular process. But once you get on that road to recovery, then it's a matter of time. Not a matter of if, but a matter of time. And knowing yourself as an individual. And I think we hear these messages, for example, when people talk about depression and so on, and it's the same case with tinnitus. You need to find your what works for you. There are various mechanisms that can help, and you should go out and you should seek help.
And you're an active participant in your own treatment.
Absolutely. Yeah, and realising some of the limitations on what we can and can't do at the moment, but coming to terms with that, and then taking on those things that can be done, because that will lead to improvement.
Well, that's great, Grant. And just nearly wrapping up, what would be the highlights of your research into tinnitus that you've found? What's been the most...
Yes, well, it's not very hard for me to get excited about my own research, but I think we've, every so often we get a result and we think, oh, that's fascinating, and I've got a great team of PhD students and research fellows, research assistants, and often it's them that are doing the donkey work on this, and I get to come along for the ride and see what they're finding out. Sometimes we're disappointed because we think we've got a great idea and it doesn't work out, and that's disappointing. But we learn from that, and we talk to other people about what we've tried and hasn't worked. I'm very excited at the moment about some work that we're looking at, mathematical models of how the brain works. And we're able to feed recordings, what we call EEG, which is really brain waves, into these mathematical models, and we can see how the model changes over time. And so this is, if you like, a form of artificial intelligence.
Wow.
So we might get to the point where we're able to feed information from an individual with tinnitus into this complicated model, and out the other end comes a prediction of what would be the best treatment for that particular person.
Fantastic, isn't it?
Now, we're a long way off doing that, but I see a future where a person may come in and see a clinician, or maybe it even is possibly done at home, where you put little pieces of information about yourself, your age, your gender, what you notice helps and what doesn't help, and maybe then we are able to do a brain recording. There's a mathematical model that processes this, and then it gives you a list of alternatives and solutions that you might yet apply. At the moment, we would be doing this by trial and error. We would say, my expertise, or what I think as a clinician, the art of science, if you like, I feel as a gut feeling, this is the best solution for you based on these sorts of things. And we would try that, and if that didn't work, then we'd work our way down a list of things, and that's not ideal, but eventually you'd come to something that worked. But wouldn't it be nice if we could come to the thing that worked quicker by being able to feed this information into an algorithm that helped us? And so I think that that's really exciting. This is where we feed all the information from all the little studies that we do and build our expertise. And so I think that there's a very bright future, and again, it's based on this individualized, personalized precision medicine, or in our case, precision healthcare, because we're not necessarily prescribing a pill, but we can learn an awful lot about that. And so I think that's a really exciting area. And, artificial intelligence is a bit of a buzzword at the moment, and we get a little bit carried away perhaps at sometimes about these, but I think that machine learning does open up avenues that we otherwise wouldn't be possible. And so I see that perhaps in the next 10 years more and more of my research will be feeding into these types of complex mathematical models. And the mathematical models are not ones that I have expertise in. Very much this is a collaboration with various groups around New Zealand in order to be able to make these things a reality. As you mentioned in your introduction, my expertise is in tinnitus. I've done this for a long time, so simply by the amount of time I've been working on it, that's reason enough to say that I've got some experience in that area. But hey, a lot of these other technologies I don't know about, but I do believe that tinnitus can help discover, be put into these, and these new techniques that other people are very creative about can potentially unlock the puzzles of tinnitus and create these various cures.
And that's the wonderful thing about science and collaboration. It's coming together, being able to offer solutions to.
And again, coming back to one of your question at the start of this conversation about the excitement.
Yeah.
Well, one of the greatest excitements that I have is talking to people about tinnitus and them showing an interest in it, and them saying, well, maybe we could do this with this idea.
Yeah.
And that really gets me excited because, one, people are showing an interest in tinnitus, but there's something that I don't understand that can be applied, and by learning from them, I learn something too, which is fantastic as well.
Well, Professor Grant Searchfield, I can't thank you enough for your time. It's been very insightful for me. I've learned something today, and it's been great talking to you. Thank you so very much.
Thank you. I'm happy to talk about tinnitus, as you mentioned.
Thanks, Grant.
Cheers.